trained doctors all over the world in cutting-edge technology, and I know that I'm so interested in listening to you this morning. Put your hands together for Dr. Zach Scoville.
Warm greetings from Cape Town. When we take it a little bit slower than up here. When Susanne originally phoned me last year to speak on the topic of collagen induction, I told her that was very 2013, and I actually thought I wasn't going to hear from her again. But here I am today to share with you all the latest tricks and trends with regards to facial aesthetics. The future of facial aesthetics is right here. Now don't get me wrong, collagen induction is all great, and there is still a scope for fillers in the practice out there. Sorry to the collagen queens there at the back, if you don't mind. But at the end of the day, if collagen was all that great, why do the Kardashians still look the way they do? Looking like Puff Daddy and all puffed up. Which brings me to my next point. In a world filled with Kardashians, we die now. And if you remember correctly, Diana used to speak with her teeth, and she used to smile showing her teeth, she used to talk showing her teeth, and she used to show her eyes. And in my opinion, if we want our patients to have a successful outcome, we should allow them to show more teeth after the treatment. If, however, our patients show less teeth after a treatment, and they don't show as much eye, then I deem that as an unsuccessful treatment. And I think that is very important for us to realize that. Sometimes the patient comes to my practice and then they bring a picture and they want to look like someone else. Then I refer that patient to a psychiatrist. At the end of the day, we're not here to create or to copy. We're merely here to enhance beauty and to allow patients to achieve their full, optimal potential. And it is really all about potential, and that is what brought me on this journey of facial aesthetics. One day I woke up, saw myself in the mirror, and just wondered why I looked the way I do. And I didn't feel that I looked the way I used to look as a child. So then I realized that due to the premolars that were removed as a child to straighten my teeth, it ended up losing me a lot of bone and supporting my face. If you look at the most beautiful people in the world, you will see that they are bimaxillary quite full. So basically I walked a path and a journey to try and help myself to look a little bit more the way that I looked as a child. And this you can often find on its side profile. I regard myself as a profile dentist, so to me, profile is everything. If a patient walks into my office, the first thing I do is I ask them to turn to the side and smile for me. You can see that due to the removal of the premolars, I then had the medically induced dish face for quite a while. Luckily, I was a very confident child, so it didn't bother me that much, but I really wanted to be more the way that I was intended to be. So orthodontics can do a lot of change. I didn't want to do surgery, and I didn't want to do fillers. I wanted a more permanent outcome and a better solution for the rest of my life. I then took it further and applied orthotropics, which is a very popular modality of aesthetics at the moment, is where we remodel the arches without the use of surgery. So sometimes it can be quite a passion killer, but at night I sometimes have to apply my headgear. So it was quite a journey, and it made me quite excited because of the fact that we as dentists are able to bring about hard tissue changes. We can remodel bone, and we are able to really transform our patients to a significant extent. So if we think about the future of facial aesthetics, what does it all entail? I believe the future of facial aesthetics is not really vanity interested. If you look at my own pictures, it wasn't about the vanity. It was more about the fact that every one of us has a certain potential, and we want to achieve that potential for our patients. But what inhibits this potential? First of all, if a patient has not been breastfed, that will lead to underdevelopment of the arches, leading to weaker support for the lips, and giving you a weak profile. Sugar is detrimental to facial aesthetics, not only leading to chronic inflammation, but also leads to early loss of primary teeth, leading to the fact that we then suffer from malocclusion, skewed teeth, and then a lot of the time premolars are removed, which is very devastating to facial aesthetics. habits, for example, mouth breathing or thumb sucking, that will also lead to a high palatal vault, leading to a lesser potential of who you really can be. Then trauma, if you can fall as a child, that can change the growth direction of the bone, and genetic reasons, for example, cleft palate. So I believe the future of facial aesthetics is more interested in fixing all of these problems, diagnosing our patients correctly, and not merely just injecting fillers or botulinum toxin into the face. Far more than that. There is obviously a scope for all of that, but at the end of the day, I believe the future of facial aesthetics is to restore our patients to their natural beauty. It's more solution focused than trying to camouflage the symptoms. It's treating less invasively and non-surgically, and it's understanding a patient's limitations. Often a patient will still require surgery, and we have to respect that, and there's still a huge scope for surgery as well. But I believe at the end of the day that aesthetic practitioners should be able to be aesthetic doctors, plastic surgeons, dermatologists, all of these different modalities of anti-aging and facial aesthetics all combined to be able to enhance our patients to their full potential. So if we look at a patient in a holistic approach, we see, for example, this 74-year-old patient that had all the different arrays of treatments, and at the end of the day, she doesn't look over-volumized, which is very much the case often. We find that people suffer from sagging, and they end up looking very different to the way that they used to look. Over-volumized, over-dramatic results, and really not doing the industry a favor, not doing our patients a favor, and actually scaring off other patients to be interested in achieving their full potential. So if we look at this patient, I can quickly just mention what I've performed on her. Botulinum toxin for the frown. It's always nice to see a friendly face on a woman, so that there will always be a scope for that. Don't, as far as you can, do any botulinum toxin in the forehead. That muscle elongates over time. If you walk a path with your patients, you will see that they then eventually suffer from excessive eyelid tissue. So, not even babies had no movement on their forehead. Try and steer clear from botulinum toxin in the forehead. You can use threads, or I can talk later on about vibrance or vibrance, which stimulates the collagen and the elastic fibers, which is part of the future of facial aesthetics. Then plexer or soft surgery, I use that around the eyes to get rid of the wrinkles there. Volume, so for the hollows we can use volume. Always remember, volume is there to fill or to add, fillers are there to add volume and not there for bags. So fillers were placed onto the cheekbones, and then if you can stimulate the skin, you are winning all the way. So this lady, if you stimulate blood supply to the face, you get amazing results. And how do you do that? You stimulate the dental arches. I used a myobraces device for her, and after 3 days already, you could see the blood supply to the skin increasing and the skin texture becoming improved. Then we use Newton cogs or Newton lifts or threads to lift the face, and to reduce the saggy fat pads, I use Chicorelli solution, which is a combination of vitamin C and iron. And at the end of the day, that is a very natural result. So dentists are really ideal in the world of facial aesthetics, because we can really bring about permanent changes for our patients. And we can really make a difference to help our patients to not over-volumize themselves, but to really focus on the problems that they are faced with. If a patient's potential exceeds our limitations, we should know how to refer. We can work together with our colleagues, or we can attend more seminars and conferences and hands-on courses to really get a grab on all these non-invasive approaches. At the end of the day, the future of facial aesthetics lies in non-invasive and non-surgical procedures as far as possible. And at the end of the day, I see the future of facial aesthetics being advanced, and that advanced treatments would be the norm, and that we should be telling our patients that we're doing all these advanced procedures, but that should be the norm. So if we look at the building blocks for treatment, first of all, we have facial aesthetics. And facial aesthetics is the science behind the face. Every face has a certain potential with regards to certain degrees and certain angles. Think Fibonacci, think Da Vinci. All our faces are encoded to look a certain way. In fact, the most aesthetic version of ourselves is often the most functional version too. I don't know if you've seen Homo naledi, for example, but Homo naledi had a very broad smile. That means that his arches were stimulated very well, so his facial support was really good. And then also, he still maintained his dentition in a very advanced age of his life. That indicates that sugar was also absent. So, if we think about it, I believe that we're all destined to look beautiful if we achieve our full potential in facial aesthetics. But since life has become so easy, our diets have become easy, we are left with weak profiles, and we now require doctors to perform facial aesthetics to help us achieve the look that we were supposed to have. The next building block is anti-aging. Now, anti-aging, as you know, is a multi-billion-dollar industry where we utilize aesthetic medicine to camouflage the symptoms of aging. And then with continuous use, our patients reap the benefits of slowing down the aging process. But aging, however, can never be stopped in totality. We still undergo bone remodeling, which leads to loss of structural support and eventually leaves us with excessive skin. So a lot of people actually invest in anti-aging medicine for their lack, or to compensate for their lack of their facial aesthetics being in place. So in other words, they invest this money because they think there is something wrong somewhere to try and look more beautiful. And because anti-aging medicine often beautifies as well, patients do invest in anti-aging. And then lastly, if we look at the last building block, we have aging. So these are normally the people that can actually afford the anti-aging drugs. And up until recently, patients that have aged were treated with anti-aging medicine. And this actually led to the over-volumization of these faces, because only neuromodulators and fillers were really available, and surgical procedures made people look really scary and weird. But what if I tell you that wrinkles don't exist? That wrinkles are merely accumulation of tissue surrounding a fold. And what if we could treat the excessive tissue in a non-surgical, non-invasive fashion? So if facial aesthetics are in place, people will invest less in anti-aging medicine, they'll be less scared to age, and they will live a little. And that is where dentists play a fundamental role in helping our patients to achieve their optimal facial aesthetics, and we actually save our patients a lot of money. So let's quickly look at the trends for 2016. I am limited for time, so I can just share with you a couple of trends that I picked up on last year's World Aesthetic Conference in Athens. The first trend would be soft surgery. Soft surgery is mind-blowing. It is the future. Have a look at this video. Now, what is soft surgery, if you might ask? No, just let's start again. Soft surgery is a revolutionary new concept where we can treat the signs of aging in a non-invasive, non-surgical fashion. By the utilization of our modern technology, we can treat problems instead of trying to camouflage symptoms, leaving patients with hardly any downtime, amazing results, and a rejuvenated face.
I've decided to come to Surgisoft today because I've just got these droopy eyelids that I want to have fixed. I hope that this is going to be a quick procedure. It's not going to be painful, it's not going to be blood involved in it, and then that I can move on with my life as quickly as possible.
I would say the main benefit is obviously the fact that there's no real downtime involved. And if you think out of a financial perspective in modern times, people have less time available and they don't want to walk around with bandages. So with soft surgery, you can create a beautiful result within a couple of minutes, a lunch-hour procedure. There's also far less pain involved. If you think about it, no scalpel will touch the skin. There's no sutures involved, and there's no risk for scar tissue formation, which we often find after surgical procedures.
So once the treatment has been completed, the client is then able to put up some liquid foundation, a little bit of ice just to combat the swelling, and they're able to go home and they can carry on as they would normally do.
It was brilliant. I couldn't believe it was so short, it was pain-free. I was relaxed during the procedure. I feel great. I can actually put on my makeup and go home. Thank you.
A Plexa treatment is basically the use of a microbeam where we apply a little bit of topical anesthetic to the upper eyelid, and then after 20 minutes start treating the excessive amounts of tissue. It's a very straightforward, very safe and a very easy procedure. It takes about 15 to 20 minutes and leaves the patient with visibly no downtime.
So Plexa is actually quite a versatile tool. It's originally been marketed to treat upper eyelids, excessive skin on the upper eyelids or the lower eyelids, what we doctors call blepharoplasty. But it also works for wrinkles, deep wrinkles, fine wrinkles, wrinkles around the mouth, what we call smoker lines, or the wrinkles around the eyes that we call the crow's feet. What we can also use it for acne, for example, acne scars, active acne, also your sunspots, things like melasma. Again, treatments that have otherwise failed patients in the past, we are now able to treat with Plexa.
So Plexa is plasma derived from nature. So you have solids, liquids, gas, and the ionized or the heated form of gas is plasma, the fourth state of matter. When we age, the bony skull shrinks. That leaves us with excessive tissue. We utilize plasma in a microbeam. When it comes almost in contact to the skin, it basically evaporates the excessive skin right in front of your eye. So that's Plexa. You'll hear a lot about Plexa in 2016. It has got a wide variety of treatment modalities. We can remove blemishes, warts, anything that was previously probably forming part of our most embarrassing bodies, or things that we couldn't treat without the use of surgery that left scars. You can even go as far as do a vaginoplasty, but I would prefer that dentist stick to the upper cavity. So the next trend is vibrance or vibrance. Vibrance is lifting without the use of injection or surgery. We use autotransplantation of tissue, and vibrance or vibrance is ideal for volume loss or sagging. So vibrance is the next generation threads. Basically, you put a needle into the one area, take the needle out on the other area, then the fibers, the elastic and the collagen fibers get stimulated, and as you put it out, the face lifts instantly, leaving you with no production cost. So basically you don't have to put any filler or thread into that area. I think for the sponsors I'm probably not the most ideal speaker. But at the end of the day, once you've paid off your equipment, you are basically left without any input costs. And also your patients look very natural. You can get very nice results, especially for lips as well, by stimulating the fibers, not having to put any filler in there. So there's no scarring or downtime, and the results last up to 12 months. It can even last a bit longer. Have a look at this patient, for example. You can be quite honest, we can't do lips with fillers to achieve this result. You will never get a result with fillers like this, because the fibers are a bit deeper, so it stimulates from the inside. So you can even take a very old lip, and that lip can be rejuvenated to a very beautiful result. Then the next trend is the nose magic. I don't know if you've heard about the nose magic. I always try all these things out myself as well, and my nose is a bit straighter already. It's a device that remodels the cartilage of the nose. So without the dangers of causing avascular necrosis by doing fillers into the noses, you can use the nose magic. Very nice device, virtually creating a perfect profile from the side as well. And this is how it looks. Also a little bit of a passion killer at night, but it's only 15 minutes this time. Then obviously hair rejuvenation. So what do Michael Jordan and Yoda have in common? They're bald, and although the shining dome used to be a sign of intelligence previously, people don't want to be bald, and they want to have their hair treated. So the trick in treating hair loss is to trigger anagen. So anagenesis. You have anagen, catagen, and telogen. No, I had your gin. But the idea was to treat the scalp very deep. Previously, we would only treat 2 to 3 millimeters. That is too shallow. These follicles sit as deep as 5 millimeters. So if you stimulate anagen, you can stimulate these hair follicles. It works very well. I had 3 treatments myself because I used to be very blessed. Hashtag blessed. And then you have to maintain collagen. And how do you do that? You use a foam, because you don't want finasteride systemically. All men will know that. But minoxidil and finasteride in a foam that Dr. Sonia van der Mesh actually introduced me to, because we have to maintain the hair. Now that we've stimulated the follicles, the hair needs to be kept on the head. So this was me after 3 months, and you actually see the real results only after 6 months. So I'll show you on the next conference. So then let's quickly run through the Dr. Zach protocol for facial aesthetics. The first step in facial aesthetics is weight. So if your patient's jowls are heavier than your dumbbells, or their bags are Prada, or they count their chins to fall asleep at night, then you first have to question the internal health of your patient. And first try and help them to achieve their optimal weight. There's no ways you can help a patient if they're not healthy in body, mind, and soul. And at the end of the day, we want that for our patients. They are the best word of mouth. Their results are far more effective. Their treatments are much easier to perform because you don't have to work against gravitation and those extra kilograms. The second step in the in my protocol is profile. Profile is everything. So hard tissue, bone is set in stone. Plastic is fantastic, but bone is set in stone. And the key or the foundation of beauty is actually our maxillary incisors. So once again, dentists are able to help people really achieve their full potential because it's all about the positioning of the anterior maxillary incisors, and they should be in relation to the anterior nasal crest. So let your patient smile. If the teeth are in the dark, don't put more filler into that lip. They're going to talk like that and they're going to look like Kim Kardashian. Not showing any teeth anymore, and it's become this whole trend where you actually see doctors that look like Planet of the Apes. We should have such a social responsibility to also tell our colleagues not to look like that, because our patients will follow suit. If the doctor looks like that, can't say that, but if a doctor looks like that, he will create that as well. So support comes from the lower aspect of the face. So that's why I always say start from the bottom and move to the top. If you broaden the smile, if you create support in the lower face, you'll actually enhance the mid face. And I'll show you that on the picture now. Avoid over-volumization, and the treatment of choice for a profile would be orthodontics and orthotropics in combination. So braces, self-ligating braces to broaden the smile, and orthotropics to get the profile perfect. So here you can see I asked my patients to smile. You can see that this patient, I automatically asked her if she wasn't breastfed or if she had her 3 molars removed. And she was very impressed with me, but at the end of the day, a look like this is induced by doctors, unfortunately. It's like the amalgam era, and now we fix the amalgams again. We created the dish faces, and now we're fixing the dish faces again. So at the end of the day, this patient will never be able to achieve her full potential if we don't move the teeth back to the anterior position where they used to be. You can also see that this patient is suffering from premature jaw formation, which would have never been the case if the teeth were anteriorly positioned, giving the face a very nice support. So I call it the Bermuda Triangle of the face. So I don't know if you can see the Bermuda Triangle of the face. If you check on the cephalometric X-ray, that is the Bermuda Triangle. That means that lips are not supported by teeth. So you're going to invert that lip by adding volume to that lip. The teeth will probably be in the dark, the lip closure will not be adequate, and the patient will never be able to look their best without addressing the teeth and bringing them back to the anterior nasal crest. So then, of course, number 3 in the protocol, the smile. Once again, dentists. So the smile is the foundation of facial aesthetics. It resembles youth. The upper lip elongates with aging. So if you want to treat that, you have to apply again orthodontics and orthotropics. Look, for example, at David Beckham and how important the smile is and what change it brings about. Or even look at Celine. A smile makes a huge difference to the face, and that's why it's part of the protocol. Have a look at this patient where I changed the veneers. But more importantly, have a look at the lip size and how the lip is expanded. This patient has much better lip support. We can do the most beautiful aesthetic dentistry, but if we don't combine it with proper orthodontics, our patients will never look as good as they can. And have a look at this young child. Broadening the smile, have a look at the lip size once again. This patient can be a model now. She will never require lip fillers. But basically those black triangles indicates lack of support to the lower face. And have a look at her cheekbones, where they were sitting previously. So by adding volume to the smile, or broadening the smile, you actually create a narrower cheek contour. You give the patient a very nice jawline, and you overall make the eyes shine and the eyes pop. So basically the patient looks so much better by fixing the smile. So addressing the lower face gives a patient a better mid-face. And it's not the other way around. We often think that we have to enhance the mid-face to rejuvenate the lower face, but it is from the lower face. So volume. Volume is something that I'm very scared of and that we all should be very cautious about. But volume can actually help and create beautiful results if we do it correctly. So if we adhere to the rules. Volume is great to fill voids where sagging has taken place. It's great for symmetry restoration, and it's good for enhancement. If a patient has got, like for example, Angelina Jolie herself gets lip fillers, but her positioning of her teeth is in a good space. So her lips can be bigger and bigger, they will still look nice because she's still showing all her teeth when she smiles. So her hard tissue support is correct. If we want to treat sagging, don't treat it by merely doing fillers. In our patients, you're just adding volume to volume loss. So the fat pad is sitting here, you're placing volume over here, you're just creating an elephant. Your patient will look terrible and you're not going to help them look more youthful. You're just going to make them look less wrinkly, but they're going to look very full. So we are not beauticians, we are doctors, and we need to diagnose our patients and be scientific about our treatments. Don't just use fillers for everything. The time of that 8-point lifts and all of these things is long gone now. There's better treatments available, and it all starts in the mouth. Once again, showing this picture, agree with Dr. Kissing. Some patients you should really not treat, and patients like this, the lips often indicate treatment. So be careful when you do lips. It can often lead to a done look. And once the patient looks done, it is deemed an unsuccessful result. If we look at this patient, for example, I just restored the symmetry of the lip and add a little bit of volume and enhance the cupid's bow. In my opinion, that is far more of a beautiful result and scientifically diagnosed without the need of over-volumization. Sagging can be treated in many different ways. We have the silhouette soft, we've got the Newton lift, which has many cogs. I love the Newton lift. We've got the derma springs, which work very well, the PDO threading for smaller areas, like for example, if you want to do a brow lift, or if you want to do a neck lift. And then soft surgery, once again, very important that we can use flexor to remove the excessive amounts of skin. You can do a mini facelift with that, and vibrance, needle shaping or vibrance. So what do we do with sagging? We stimulate the I never can pronounce this, the SMAS layer. It's the layer that is between the muscle and the skin, the submuscular aponeurosis, and we stimulate that layer to treat the looseness or the sagging of the skin. So there you can see that the fat pads actually migrate. Once in our lives, they were all in communication with each other. Once they start to sag, we see these jowl formations, so we need to treat the excessive fat pads, and that we do through facial sculpting. We do the lifting by means of threads or flexor or vibrance. So this double bulge effect, here you can see that this patient has been treated incorrectly, over-volumized, and still is left with sagging. This is the lady that I showed you from the side now. Have a look at the improvement in her overall look. She looks much younger, much more confident, and she doesn't look different. Everybody will just think she's been on a good holiday, and I think that's the idea of aesthetics nowadays. Facial sculpting is number 6 in my protocol. Here we treat the excessive fat pads with the Ciccarelli solution. As I've said, that is just a mixture of vitamin C and iron, and you basically cause apoptosis, which is natural cell death. Steer clear from now cell necrosis. You don't want to affect any cell necrosis. That's very dangerous. So deoxycholate, be careful for all those fat dissolvents. So that's facial sculpting. Then if we look at the eyes, the youthful eye, then we often have bags underneath the eyes. Okay? These bags should not be filled. Once again, I see a lot of people filling bags. Bags should not be filled unless it's Louis Vuitton. But when we see the aging eye, we see that the fat pad actually prolapses. And there's two ways we can treat that. You can either stimulate the fat pad by almost a means of a cauterization technology, or you can use Ceccarelli, and Ceccarelli gives very nice results. Now I've done the Ceccarelli solution, now there's a bit of wrinkles, so the next step would then be to treat these wrinkles with Plexer or with soft surgery, and you see the skin evaporate right in front of your eyes. This lady, for example, once again, you think, let's get rid of the fat first. So diet, and then Ceccarelli, and from there to there. And that's all just done with the functional medicine. Now we can start with the threads. Now we can start with the rest of the treatments. But first get them volume-wise to a smaller face. The new fashion is not a bigger face, it's a more intact and a more sculpted face. This lady had plastic surgery. She came in, she was very disappointed. She was in a major car accident, and the plastic surgery basically pulled a vector into her face. So this is her without even smiling, looking very weird. And with Plexer, you can remove the excess of skin, and she's over the moon with the results. And so non-invasive and really restored her beauty. In the next picture, I think it's one of our colleagues that allowed me to use this picture. If I can get it, there we are. That is my one dental colleague, and he is always complaining about his saggy eyes. And this is after one treatment. After 5 days, you can still see the little scabs. So the idea is just to cover these scabs with liquid foundation, and then after 5 days, the scabs come off, and the skin looks beautiful. It opens the eyes. So if we look at this patient, for example, see how beautiful the eyes are open. These treatments were never possible previously. So now we can really restore a patient to their optimal beauty. Combination treatment, but most importantly, have a look at her eyes and see how open her eyes are. And you would agree that she looks rejuvenated without looking done. So then lastly, or actually most importantly probably, is our skin. Skin is the biggest organ, so we have to focus on the skin. The latest trend worldwide is actually to not take something out of the skin, so to start walking away from all these peels and these excessive peels that thin the skin and causes inflammation and later on triggers pigmentation, but rather to boost the skin and to resurface the skin. And that we can do with a combination of, for example, Dermapen, and then administering hyaluronic acid into the correct layer of the dermis, so that we can utilize the hyaluronic acid to produce collagen, and so there is scope for collagen then after all. No matter how ugly you feel, you'll never be as ugly as this. Never overvalue the body that you're in to the soul that you are. Be the best you that you can be. Thank you.